of Fingolimod versus Interferon Beta-1a in Pediatric multiple sclerosis. Definition: multiple sclerosis (MS) is the result of an anti-inflammatory and damaging process at the axon sheath of the central nervous system. It manifests with focal-motor sensory cognitive alteration.
Multiple sclerosis is a demyelinating disease of the central nervous system, which includes the brain and the spinal cord. Myelin is the protective sheath that surrounds the axon of neurons, allowing them to quickly send electrical impulses. This myelin is produced by oligodendrocytes, which are a group of cells that support neurons. In multiple sclerosis, demyelination happens when the immune system inappropriately attacks and destroys the myelin, which makes communications between neurons break down, ultimately leading to all sorts of sensory, motor, and cognitive problems. Now, the brain, including the neurons in the brain, is protected from things in the blood by the blood-brain barrier, which only lets certain molecules and cells through from the blood. For immune cells like T and B cells, that means they have to have the right ligand or surface molecule to get through the blood-brain barrier. This is kind of like having a VIP pass to get into an exclusive club. Once a T
Application in nursing. Control of virus site perform a control of adhering to the treatment, prevent complications secondary to the disease, detect risks or problems that can affect the health of children.
The diagnosis of pediatric MS can be challenging, particularly since most pediatricians will only rarely encounter a kid with this. The frequency is maybe 1 per 100,000, more or less. So it's not a common thing. And the other challenge is that sometimes little kids have symptoms they don't tell anybody about it. So as an example, a typical presentation is optic neuritis, which is inflammation of the optic nerve, and the symptoms associated with that are vision loss or diminishment of vision. And we've run into situations where a child will have that occur but not say anything until it happens to the other eye, and then they can't see at all, and then you go back and get the history. So vision changes, such as loss of vision, is one very common presentation. Another symptom that can happen is problems with weakness and balance. And just the other day, I saw a youngster who saw their pediatrician with such complaints that they were dragging their leg. And it was thought, oh, they must have just slept on their leg funny that night or something. So it can be minimized because so often kids get better with just
Pros and cons. Pros. The progression of multiple sclerosis is slower in children than in adults, and both tend to accrue physical disability and the time to risk of secondary progresses. Cons. Eye problems issues with blood pressure and heart rate.
My name is Mark Patterson. I'm a child neurologist at Mayo Clinic in Rochester. Today I'd like to talk to you about multiple sclerosis in children. Multiple sclerosis is a disease that most people have heard of. It is described as an inflammatory disorder that affects the white matter of the central nervous system. In neurology, we think of a particular aphorism to understand multiple sclerosis, and that is that it's a disorder in which lesions, in this case plaques, occur within the white matter of the brain and spinal cord in different places at different times In other words, we say that they are scattered in place and time. Fortunately, thanks to the advent of magnetic resonance imaging, the diagnosis is much easier than it was in the past. Patients may present in a variety of ways depending on where the lesions occur in their central nervous system. There may be episodes of sensory change, of weakness, which can involve the arms, legs, one side of the body or the other, depending on the location of the lesion. Many patients will have involvement of the optic nerves, which can cause pain and vision loss within the optic nerves. Others, there may be involvement of structures in the brainstem or cerebellum, which can cause unsteadiness of gait, slurring of speech, weakness of the face, difficulty with articulation and chewing, and so on. In fact, almost any combination of symptoms referable to the nervous system can be caused by multiple sclerosis.
Issue apply in Ecuador. Multiple sclerosis typically appears in young adulthood, but approximately 3% to 5% of cases have an onset that occurs in childhood or adolescence, usually with a relapsing, remarrying parent.
Pediatric onset multiple sclerosis accounts for 3 to 5% of cases of multiple sclerosis and is mostly characterized by a relapsing remitting pattern. Fingolimod is an oral sphingosine 1-phosphate receptor modulator used for relapsing forms of multiple sclerosis in adults. Trials in adults showed that Fingolimod once daily significantly reduced progression of disability in relapsing remitting multiple sclerosis as compared with placebo. This randomized double-blind trial compared Fingolimod with intramuscular interferon beta, the current standard of care in pediatric patients with multiple sclerosis. 215 patients between the ages of 10 and 17 were randomly assigned to oral Fingolimod once daily or to intramuscular interferon beta once weekly for up to 24 months. At up to 24 months, the average number of relapses per year and the average rate of new or newly enlarged T2-weighted MRI lesions per year demonstrated statistically significant differences between the Fingolimod group and the interferon beta group, favoring Fingolimod. 18 patients in the Fingolimod group and 7 in the interferon beta group had at least one serious adverse event, with 6 patients in the Fingolimod group and 1 in the interferon beta group had convulsions. This trial demonstrated the superior efficacy of Fingolimod over interferon beta in reducing relapses in pediatric multiple sclerosis. However, more patients had serious adverse events with Fingolimod. Full trial
Conclusion. Fingolimod was associated with a lower rate of relapse and less accumulation of lymph on MRI over a 2-year period that Interferon Beta-1a.
Diagnosis of multiple sclerosis requires that there is dissemination of a disease both in space, which means involving multiple areas of the central nervous system, so the optic nerve, the brain, or the spine, and that it is disseminated in time, meaning there is more than one event. And that can be confirmed clinically by another attack or by MRI, where there are new changes that indicate new disease activity. The McDonald criteria are international criteria that were created by experts in multiple sclerosis to help clinicians make the diagnosis of multiple sclerosis in a person presenting with the first attack of what might be multiple sclerosis. And so the most recent version, the 2017 McDonald criteria, allow you to confirm the diagnosis of multiple sclerosis in a person with a first attack, so they have not yet had the multiple part, at least not clinically, if their MRI shows multiple, what we call lesions, or multiple areas of where the immune system has attacked in the brain and or spinal cord. It also includes a test called spinal fluid oligoclonal bands.
Thank you.